The word that best describes this evening's first Children's Miracle Achievement Award recipient would be gentle. Early in his career, Dr. Ignacio Ponseti pioneered a gentle method to treat club feet. Dr. Ponseti's peaceful method of treating one of the world's most common disabling birth defects has been helping children for more than 50 years without invasive surgery. However, it is just recently that his method has been widely adopted for treating infants with club feet.
It's remarkable. At 92 years of age, I said 92 years of age.
I heard you. I'm not sure they heard you.
I'm not sure they did. Dr. Ponseti may be an emeritus professor, but he cannot be kept away from his babies at Children's Hospital of Iowa, where he still treats many children every day of the week.
Our baby girl, Jude, was diagnosed through ultrasound that she had club feet.
Our doctor had said that he thought he might have a club foot.
I was a little worried at first. Still am a little worried.
The doctors had told us that it was something that could be easily corrected. It was nothing major. And so when he was 4 days old, we went to a specialist, an orthopedic surgeon.
Surgery is not a solution for clubfoot. The Ponseti method is based on a stretching of the ligaments and tendons and then place the cast in that correct position.
We came in to see Dr. Ponseti, and they applied the first set of casts that day, and then I believe they took them off about a week later. And at that moment, I knew that this was right.
It's like watching this miracle unfold, one cast change at a time. Every time they took a cast off, you know, her foot was in a different position, moving closer and closer to that goal of where we wanted it. And it was so incredible to see.
It's just absolutely brilliant to think that the child is going to have a relatively normal foot for the rest of their life without any surgical intervention.
The mission that we have now is to spread the word and to teach and develop educational programs around the world so people learn how to do the method properly so the results can be in the 95 to 100% compared with any other method, which goes from 20 or 30% correction to 10% correction. It's really gratifying to see the families to see that change and be so happy and knowing that, you know, the feet are going to be fine for the right foot patient and the kids will be able to run, play, bike, and do any sports that they want when they grow up.
Dr. Ponseti thinks that he's going to be absolutely normal, so I have faith in him.
Good.
That was a good one too.
Yeah.
So what do you think of Dr. Ponseti?
What do I think?
Yeah.
I think he does miracles.
We thank Dr. Ponseti so much for the miracle he's created for our daughter and for the miracle he's creating for all these children around the world. We love him dearly, and he will be forever in our hearts.
Do you get it? Now you know who this man is? Ladies and gentlemen, please join us in welcoming to this stage and honoring Dr. Ignacio Ponseti.
I'm most thankful for the great honor you have bestowed upon me, and I shall treasure it for the rest of my life. I have been treating babies for the past 65 years. And so I will recall the epidemics of poliomyelitis. In 1951, one of the worst years, we had in Iowa 600 babies with poliomyelitis in the fall. And that was an enormous disgrace for the family and the stress for all of us. And, but this was cured with a vaccine. And now this disease has disappeared. Other diseases that I had seen during my life was tuberculosis of the bones and joints in children and osteomyelitis. All these disorders disappear with antibiotics or with vaccines. But now clubfoot is one of the most common musculoskeletal disorder that we see in children. It is very crippling unless you treat it. And if treated surgically, which has been done for many, many years, the feet get to be weak and stiff and painful. And this gets worse as time goes on. So by the time that the patient is 20 or 30 years old, very often he can barely walk. Over 50 years ago now, I developed a technique to treat club feet without surgery. It was based on the study of the nature of the deformity to understand the club foot and how the motions, how the movements of the joints and the club foot occur, and the fact that the ligaments are stretchable. So I was able to stretch gradually in the ligaments and put the bones in proper alignment without doing any surgery. I've published this about 10 years after I started. In 1963, I had a 10-year follow-up. And then I publish every 10 or 15 years the results. But doctors disregard this. And my good results were welcomed by parents, by the few parents that live in Iowa. We had 3 million people there when I got there in 1941, and now there are still 3 million people. So the number of club feet that I had was not very great, but it was sufficiently important to know that I was doing the right thing. But the doctors did not follow it until I published a book that my wife wrote, really, and I published a few papers with a follow-up of 30 years showing really that these feet were normal. Finally, therefore, the profession kind of thought that maybe they should try, and a few doctors actually did try. But the method did not really gain popularity until I published it in the internet. And a few parents read it, and then Mr. Egbert is here in the audience, and he was one of the ones who first pushed the doctors really to change their technique, to get the doctors interested in trying my method. And it has therefore been a treatment that has been popularized by the parents. The doctors have followed what the parents demanded. And this is a story, of course, I think a very touching story, because I have luckily been allowed to live up to my age, and I have been able to see, just in the past 10 years, an enormous spread of this treatment throughout the world. To have Children's Miracle Network play an active role in eradicating the clubfoot deformity from the world is a dream come true. I thank you very much for inviting me.